So my talk is called "It Takes Two to Tango: How Co-Designed Games Lead to Improved Patient Experiences and Better Outcomes." So I thought I'd give you a little bit of insight as how we work together with patients and the target group when we design games for health, which is our main focus in the company. So as Pete already introduced us, I'm the CEO of Imaginary. I'm based in Milano. So that's where the sunny hello comes from now. In our 18 years experience, we have been working a lot with game psychology and game mechanics to deliver game-based solutions, mainly in the meantime in the area of e-health. And this we have done through over 30 European projects. And well, yes, we won several awards, which tell us that we are probably on the right way, or at least on a meaningful way. And this we could do thanks to our multidisciplinary team. Actually, yes, I'm a mathematician, like Pete said already, and one of my favorite people that I admire, of course, a lot is Albert Einstein. He said once that if he had an hour to solve a problem and his life depended on it, he would use the first 55 minutes determining the proper questions to ask, which, in my opinion, is super interesting and which is exactly what we're doing with our methodology when we design games for health. So in other words, the games that we deliver are the Tango. So they're not designed by us, but they're designed by us together with the target group. So we involve, of course, subject matter experts because they have to be scientifically sound, and we have to deliver some experience which is scientifically sound. So we have a clinical objective to reach most of the time. But also, on the other hand, we have users and we need to motivate these users, because if we want to change behaviors or raise quality of life, engage patients in, for example, therapies or care pathways, rehabilitation, and so on. If we want them to support adherence and stick into the program, then we have to motivate them. And, you know, in order to motivate people, you have to know exactly how these people react to certain stimuli and how to trigger that motivation. So to do that, we have our psychologists. And in the picture, you see my colleague Antonio. He's working with us at least for over, I don't know, 10 years at least. So he's the lead expert in all these motivational activities which are behind our games. So after Antonio finds out how to motivate the users, then we have game designers who take it up and work on mechanics and they try and shape the game. Then we have a whole series of technically skilled people who put together prototypes. We have graphical artists who design the interfaces. We have learning experts who see that the messages are delivered, and the whole solution is checked and checked again with the specialists as well as with the target group. What we delivered over the years are very, very different solutions. So you see in the upper left corner, for example, a game that reminds us of these old table games, which was a solution for active aging. So while elderly people were doing exercise and both on the motor side and the cognitive exercises, a little puppet, which is this little dog, I hope you see the dog in the picture, the dog is here. The dog was traveling Europe for the user, and the dog wanted to reach all these interesting points of points of interest in the city. Like, for example, this is the Tour Eiffel, this is like a Sacré-Cœur. So the dog is in Paris right now. And the dog wanted to go on to explore Europe. And to make the dog move forward, the elderly person had to do exercise. And then they would receive from the dog a postcard. So this is a gamification technique to actually see that the dog had reached this this part of the town. And there was a sort of social engagement form as well, where you could challenge somebody else saying, my dog is already in Paris, where's yours? And so on, so that people were having a little bit of fun together exploring Europe. Because, for example, the motivational studies said that traveling as well as pets were two of the favorite topics and items that were motivating elderly people. If you want to motivate teenagers like this game here, of course, you need something completely different. So this was a game where the teenager was wearing a bracelet. The bracelet was measuring movement in real life, and the movement in real life was charging this battery in the virtual game that was needed as a sort of fuel to make the game run. And in the game, you had to scan people and fight zombies and play some mini games about nutrition. This was a game to fight obesity. And actually, it was a game mixing dynamics in the real and in the virtual environments. This is a game for children with cystic fibrosis. So it's a training game for children on a tablet, which you see, for example, even only from the graphical look and feel is completely different than the other one. And they had to take care of this little puppet, which in a way was having the same issues as the child. So they took care of the puppet, learning how to take care of themselves. And this, I will not go into detail, are learning games for professionals. So you see that solutions have to have very many different characteristics, not only in the graphics, but also in the way you use it, in the narrative, in the way you mix different elements. So these things you can define only together with the target group. I will go a bit into detail in our biggest project, which is now our main product, that relies on 10 years research in the meantime. It's called Rehability. It's a system for telerehabilitation based on games. This is a neurology clinic in Milano where they're using the system. This is the system. This is a real patient using it. So the patient is playing in front of a camera, which is reading the patient's joints. And this is the way to interact with the rehabilitation games. These are motor games, which of course contain cognitive stimuli as well. They are for the upper limbs, for the lower limbs, for the balance of your trunk. So you can actually use or design these games for very many different kinds of movements. You have different elements of cognition like memory, attention, comprehension of written language, and so on. And the idea is that these games, and the same is valid for a system, need to be tuned very, very specifically for a really well-designed type of patients. Of course, there's specialists on the other side of the system who have screens with analytics and data and reporting, because they have to check how the patient is performing and how they're moving, what is going on, and so on, and in case they have to make decisions. This system is our biggest piece of work. It won a lot of awards. It has very high motivational indexes of over 90%. I will go a little bit into some anecdotes with you together with the characteristics of the system. For example, the games in the system were designed completely together with patients in the neurology area. These are all neurology games. Of course, the whole system in terms of the movements and the stimuli needs to be designed with the specialists, but the kind of games need to be designed with the target group. The pathologies that we choose are pathologies that typically affect people from, say, 60 to 95. So these games were designed really with elderly neurology patients who delivered information as what is motivating them. Then, of course, they can trick you out, because then sometimes they are lazy, sometimes they are in pain. For example, this is a very fragile category of patients, for example. So in a way, they find ways of using the system that you as a specialist, even a game designer, don't even think of. So sometimes my colleague Antonio, that you saw in the picture before, really took the system very proud of what we had produced as a prototype during research. He went to test it with some patients, and then he really had to come back the first time because the first patient couldn't even reach the start button. And then because patients could trick him out, finding ways to use the system, which were then not delivering the movements that specialists had planned. So in a way, it's fundamental to try and experiment every little detail of the system together with the patients. You might have seen one of the cognitive games. I don't know if I have it in the slide here. Well, you have just a little bit of this one here. We have some cognitive games which have elements like a bit like icons. We had very nice graphics, and then we found out, for example, that the graphics was not the right one in terms of colors, positions of elements, lines, and so on, to support people with MCI, with some cognitive decline. So we had to throw away everything and design it again. So in other words, every little element needs to be really designed together with these patients in order to serve both the scientific aim that you have, as well as as supporting the motivation of the patients. As I said, we have like these motivational indexes, which are very high. So elderly people like to play the games. They would like to suggest them to peers. And actually, the efficacy of the system is also comparable with traditional therapy. So in the end, we were even able to certify this system as a medical device. The awards that we won are interesting because they come again from all the stakeholders of the community. So it's patient associations, it's the scientific community, it's the medtech industry, and it is the public administration. So you see that actually it takes a lot of people to tango, not actually only two. You have to take very many aspects under consideration. One of our issues we are mostly proud of is when we get patients' feedback. An association in Italy, as is written here in this slide, reports the satisfaction of patients who said we were feeling as losers in our life, and now we found out we're able to win again. I can really tell you stories, I could go on for hours, about patients that we met, even therapists sometimes. I mean, we went to train some therapists in Sardinia, and they suddenly came into the room with 3 patients in a wheelchair. And I thought, what is going on now here? And actually, they were just thrown in front of these games. And in the end, they were laughing all together, and they were super happy to play these games. So actually, this is exactly the feeling with which we want to address our target groups. And this is, I think, the reason in the end why we want to go on producing these games. So I think that with this, I will close my presentation. And I'm very happy to have some interaction with you to answer some questions, because I'm quite sure that you might have some further curiosities here.
Thank you for a great talk, Lucia. I really like that. In fact, already there's feedback. Wonderful. Thanks for sharing. I've pulled out some stuff. Let's have a little look. So Victoria says she'd love to try one of the games. I think.
Yes, unfortunately, because this is a complex system, it's nothing that you can use online. So it's a complex client server system where you have the server in the cloud and the client is installed in either in our offices or actually normally in a clinic. And then you have a patient station for the patients at home. So this means that you can try it only if there is somebody having the installation there. What we do is we do lots of demos because that works online very nicely. We do them either from our offices or from the Microsoft Center in Milano, because what they put together is, maybe Pete, we can organize one session there. It's a patient journey which they put together with several technologies. So they have one with the HoloLens, they have our rehabilitation for the telerehabilitation, they have one system for the triage, and then home monitoring starting from a need triage. So we can also do some sort of demos there because they have rotating cameras and so on. So we can show a patient experience and then a little bit of what is behind the lines there.
I mean, obviously, I'm going to say yes. Great idea. Let's do a session in Milan.
Of course, Pete, you can come here directly.
So Victoria said rehability is inspiring.
Thank you.
And Fabian says he loves the use of the Kinect. It's
nice. You saw the Kinect, of course, in the video. We all know Kinect is not on the market anymore. There are other cameras practically doing the same trick. So the video was done with the Kinect clearly. So the comment is perfectly correct. We have other cameras delivering exactly the same experience.
Yeah, right. And then we've got a question here from Karen.
Yeah.
Do you use gamification techniques in your app, or do patients only play games?
Well, it's not really an app, it's a full system. We don't really use gamification techniques. It's mostly games because the patients get a feedback according to the correctness of the action they are performing. So they get stars, they get a sound, and they get scores going up or down. And if they do a mistake, it's a bomb exploding. So it's a visual and audio feedback plus the scoring. And at the end of the game, they get a score, final score for that game that they just played. And it's interesting because at the beginning, we didn't have anything else, but then it was the patients asking us, did I do any better? How did I do last time? And so on. So they wanted to compare themselves with themselves, not with other people. So we also have the best high score in the same game by the same patient. And of course, there is a message and clapping and so on if they get a better high score. So it's not really directly gamification.
I guess my final question is what are you working on next? Where do you see games and gamification in health going?
Well, what we're working on next is the other versions actually of rehability, and we have a lot to do there because the certified one is the neuro version, and we already have a prototype for a cognitive version, for a cardiac version, for a kids version. We're working on rare diseases, and there's a lot more to come, of course, orthopedics and so on. The point is that it takes a lot of time. What I've shown you is the result of 10 years, no joke, because apart from setting up the whole system, you have to design the games to test every game and then to test the whole system, validate it, collect data, and publish scientific papers to certify it. Because if you don't do this, it cannot be used in a medical setting. So the next step will also be integrating with other systems like home monitoring and so on, because we have to go towards connected care. Although we have to take it step by step, because connecting a lot of things all together is too difficult. And we also have to go through reimbursement policies and so on. So the landscape is promising, but very complex.
And do you think there's much scope for more games in the health?
Yes, definitely. I mean, you have so many pathologies, so many kinds of games. You have so many needs also, because you have prevention, you have, this was rehabilitation, but then you have prevention, you have active aging, you have some, for example, surgery protocols, which foresee some exercise even before surgery to guarantee that surgery gives the maximum benefits. And then you have all the pathologies that you can, like I showed the little game for the children with cystic fibrosis. You can also take a patient through the way of a pathology. So you have so many things that you can do there. So there's a lot of space.
That's brilliant. Now it's time is up, so it's time for a comfort break for everyone. But thank you very much, Lucia.